My name is Victoria Frye, and I'm an associate medical professor at the CUNY School of Medicine at City College in the Department of Community Health and Social Medicine. My research focuses on HIV and intimate partner and sexual violence prevention. To prevent intimate partner violence, we really need to break the cycle of violence in families and communities. And one of the ways that we can do that is to create social environments where intimate partner violence is not acceptable or tolerated. Social environments can include things like buildings, churches, neighborhoods, other houses of worship, all sorts of places where people gather and communicate with each other. In my research, one of the things that I've learned, and I've conducted research using a method called concept mapping, is that New York City residents are willing to engage in different types of behaviors to try to control intimate partner violence when they know that it's happening in their communities. They do not necessarily think it is feasible or safe to intervene in an acute incident, but they are willing to engage in lots of different behaviors prior to incidents or when they know that something is happening. So they're willing to engage in behaviors that would support, for example, a mother with her children or provide information. They're also willing to engage in behaviors that would interrupt communications that offer support for intimate partner violence. So we do know that there's a range of behaviors that people are willing to engage in. And so the advice that I would actually give would not be necessarily to the New York City residents, but it would be to agencies and institutes that come in, or institutions that come into contact with large numbers of the public. So the New York City public school system and other public systems should be offering trainings and workshops and opportunities for residents to learn how to safely and feasibly engage in what we call bystander behaviors to prevent intimate partner violence. So two things that I've learned through my HIV prevention research that are perhaps not well known to the general public. The first is the connection between HIV stigma and homophobia and adverse health outcomes for people. In HIV prevention, the research is very clear that HIV stigma and homophobia are associated with numerous adverse health outcomes, mental health outcomes including suicide or suicidality, sexual risk behaviors, and other mental health outcomes such as depression and anxiety. But the general public doesn't really know that. They need support in making the connection between forms of discrimination around HIV, around sexual orientation, and the health outcomes for them, their loved ones, and their communities. So we conducted an evaluation of a program called Change, Challenge HIV Stigma and Homophobia and Gain Empowerment, and that was part of the work that we did, was that we offered people the opportunity to understand those links and to consider different ways of thinking and behaving so that the impacts of their biases, which are potentially very hard to change, are less on the people around them. So we did workshops with individuals and we did workshops with organizations to help them with that. And I was surprised that sometimes people had a hard time making that connection between different biases and forms of discrimination and health outcomes. So that was the first thing. The second thing that really surprises me is the number of folks who don't know about something called PEP and PrEP. So PEP and PrEP are chemoprophylaxis for HIV. PEP is a medication that you would take after being exposed to HIV, and PrEP is something you can take before being exposed. And both of them will prevent infection. Particularly, the research is very strong among high-risk groups, such as men who have sex with men. And a lot of people don't know about it, and it's really unfortunate because it is a way to prevent infections. And so another study that we're doing is designing a media campaign to try to make sure that the word gets out, particularly in Upper Manhattan and the Bronx, around the availability of PEP and PrEP and making sure that folks can access it when they need it. If I had to choose 3 words to describe my CCNY faculty and research experience, they would be hopeful, they would be critical, and limitless. I say hopeful to start because the experience that I'm having with the students here makes me very hopeful. They are incredibly engaged, they're incredibly bright, they have open minds, they are divergent thinkers, they are ready to think about the world in a different way, and it's such a markedly different way than the way people from my generation and generations past have thought about the world. And for me, particularly given the environment that we're in now, I find that to be very hopeful. The second word I would use would be critical. This is a campus and an institution that is very critical. We use critical theory to examine all of our research, or to examine most of our research questions, or many of us do. We are critical of ourselves and how we conduct ourselves. We hold ourselves to very high standards, and we're critical of each other, so in the sort of lay sense of that term. And I think that that's a very good thing. I think it encourages us to always be challenging orthodox and traditional ways of thinking about things, and it pushes us to always be doing our best research, our best teaching. And I don't think we're afraid of being critical, and I think that's a very positive thing. The last word that I chose was limitless, and in a way this can be very overwhelming because as a faculty member I'm surrounded by hundreds if not thousands of fellow faculty members who are researching and teaching and do scholarship around any number of things that I might be interested in, so the opportunities for me to collaborate are almost limitless. So I'm constantly having to sort of rein myself in and make sure that I'm not trying to connect to too many people and trying to do too many things. But that's also very exciting because the opportunities to connect with different types of scholars and researchers here are just incredible. If you have an interest in doing something, there is someone in the CUNY family who is doing that and you can work with. That kind of brings me though back to critical. So just to be critical again, we often, to really reach our full potential, the limitless potential, we need to make sure that we have the adequate resources. And so, we always are trying to critically evaluate whether we have those and make sure that we get them for our students and for our faculty so that we can all reach our full potential here.